Good morning. The first item of business is general questions, and at question number 1 I call Lorna Slater.
To ask the Scottish Government what its response is to report that Edinburgh City Council plan to displace up to 700 residents living in unlicensed temporary accommodation this winter without suitable alternative accommodation available.
Cabinet Secretary Shirley-Ann Somerville.
Everyone has the right to a safe and suitable home. The Minister for Housing and I met twice with the leader of City of Edinburgh Council and the housing convener and have pledged to work with the Council on its plans to resolve this problem. Scottish Government officials are meeting daily with council officers. All options are urgently being explored to ensure that affected residents are fully supported and, where necessary, rehoused safely.
Lorna Slater.
The situation in Edinburgh shows the overwhelming need for an urgent human rights-based response from ministers and local authorities to the housing emergency. There must be no dilution of existing legal protections for people experiencing homelessness. Will the Cabinet Secretary work with the local authority, local stakeholders and public bodies who may have suitable accommodation to find a pragmatic solution that ensures that nobody ends up on the streets after the 30th of November?
Cabinet Secretary.
The Minister for Housing and I were pleased to meet with Lorna Slater and representatives of charities working in Edinburgh yesterday to outline the urgent steps that we're taking alongside the Council to find a solution. I said at that meeting, and I'm happy to confirm again today, Presiding Officer, that we are looking at all options that the Scottish Government could undertake, and we will do so in conjunction with stakeholders so that we ensure ourselves we are aware of the consequences of any proposed change and base our solutions, proposed solutions, on data and on evidence. And I once again give that commitment to Lorna Slater today and indeed to those that were at the meeting we were both at yesterday.
Ben Macpherson.
I thank the Cabinet Secretary for the answers that she's already given and the collaborative approach that's being taken with City of Edinburgh Council in this very worrying situation. The situation that has emerged is, of course, partly a product of the housing emergency and it being most acute here in the capital. Therefore, can the Cabinet Secretary set out what additional support and specific support the Scottish Government is providing City of Edinburgh Council, including what share of the £40 million acquisition fund is being allocated?
Cabinet Secretary.
So the £40 million acquisition fund was in the main targeted to local authorities with the most pressures, and that meant that Edinburgh will receive just over £14 million as part of that £40 million allocation, and they can use that for both acquisitions and to bring void properties back into use. The void properties obviously being something which is usually the responsibility solely of the Council, but the Government has stepped in with further flexibility on that. This takes the total available investment in affordable housing in the city this year to over £49 million.
Question number 2, Martin Whitfield.
Very grateful, Presiding Officer. To ask the Scottish Government what steps it's taking to reduce waiting time for dental extractions in rural NHS board areas.
Minister Jenny Minto.
Thank you, Presiding Officer. Any long wait for surgery is highly regrettable. However, it is important to note that the overwhelming majority of NHS dental care is delivered in a primary setting. We are working with health boards to develop detailed annual delivery plans to support waiting list reductions and improve productivity. We continue to target resources to ensure people waiting the longest are treated as soon as possible.
Martin Whitfield.
I'm grateful as the Minister for that response, but Freedom of Information results from NHS health boards reveal the failure to deliver adequate dental care across Scotland. NHS Dumfries and Galloway, children wait an average of 42 weeks. NHS Ayrshire and Arran, 20 weeks. And NHS Lothian has seen waiting times rise by nearly 300% since 2019. The NHS is an emanation of the state. The UNCRC Article 24 is clear and gives the right of every child to the highest attainable standard of health and access to essential care. What is the Scottish Government's defence to the failure to live up to that human right?
Minister.
I thank Martin Whitfield for his question and recognise the waiting lists are far too long for young children. I have visited the dental hospital in Glasgow to see what work that they are doing to improve throughput and the work that they are doing with health boards. I also met with the BDA Scotland last week and listened to their concerns as well. As I noted in my first answer, we expect health boards to deliver annual delivery plans to clearly set out how they will access long waits across all specialities, including paediatric dentistry.
Question number 3, Willie Coffey.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update on how it can make communities safer from the use and the impact of fireworks.
Minister Siobhan Brown.
Thank you, Presiding Officer. We've introduced a number of measures to limit unsafe and antisocial use of fireworks, including restrictions on supply and giving powers to local authorities to designate firework control zones. Like the police and partners, we are keen to explore further opportunities for addressing and preventing disorder of the kinds that we have seen in some places. I've written to the UK Government asking for a meeting to discuss what more can be done on fireworks regulations. We will continue to engage with the UK Government to gauge opportunities to improve fireworks regulation.
Willie Coffey.
Can I thank the Minister for that answer? She will be acutely aware of the traumatic impact that the noise from fireworks can have on family pets and wildlife in general, with more examples each year of animals actually dying with fright from the noise, and not forgetting also people who suffer from post-traumatic stress disorder too. Would the Government consider what more it could do to persuade people to opt for silent or low noise fireworks? They're readily available, just as spectacular in terms of their visual displays, but they don't cause any traumatic effects to our household pets and wildlife and those other citizens that I've mentioned.
Minister.
Thank you. I agree that fireworks should always be used responsibly, and particularly considering the noise impact. I've noted with interest that there is a private member's bill in the House of Commons mandating the use of silent or low noise fireworks. The legal maximum noise level for fireworks is defined within the UK-wide legislation, and I have written, as I said, to the UK Government to request a meeting to discuss updating firework regulation, and I recognise that we share the goal of enhancing community safety and well-being, and I plan to address the noise issues as part of these conversations.
Question number 4, Ross Greer.
Thank you. To ask the Scottish Government what discussions it has had with East Dunbartonshire Council regarding the condition of Mulgai Primary School.
Cabinet Secretary Jenny Gilruth.
Scottish Government officials continue to be in close contact with the East Dunbartonshire Council regarding the condition of Mulgai Primary School. The Council have advised that they have had a number of site meetings at the school with the Parent Council, councillors and MSPs. They have stated that these meetings were positive and helped the Council to demonstrate that work has been completed to date. Further remedial work is planned, and the Council has assured us that they will continue to engage with the Parent Council and school community as it progresses.
Ross Greer.
Thank you, and I thank the Cabinet Secretary for that answer. Mulgai Primary School is a Victorian-era building in poor condition, and East Dunbartonshire Council had a plan for a full and thorough refurbishment that should have begun by now. That plan had to be put on hold as a knock-on effect of the previous UK Government's decision to cut Scotland's capital budget by 20%. The immediate urgent remedial work that has taken place has resolved some of the most acute issues, but a thorough refurbishment of the building is clearly required. This is the consensus of all political parties and all elected representatives in East Dunbartonshire. So I'd like to ask the Cabinet Secretary if she would be willing to visit the school with me, and if, given the slight relief to Scotland's capital settlement as a result of the most recent UK budget announcement, if the Government would consider an increase to the Learning Estate Improvement Programme to allow both Mulgai Primary but also the other schools in East Dunbartonshire that require refurbishment or a full rebuild to proceed.
Cabinet Secretary.
So I thank the member for his interest in this matter. I know he's written to me directly on it, and I'm happy to confirm on the record today that I will visit the school with him and ask officials to continue their engagements with East Dunbartonshire Council. I think it is worthwhile putting on the record, though, that the funding announced in the UK Government's autumn statement was broadly in line with our planning assumptions. However, we will, of course, continue to carefully look at the context of education consequentials. The member will know that, of course, the reason the new UK Government have had to be forced essentially to prioritise investment in school buildings is as a legacy of the Conservative Government previously starving investment in school buildings in England. That is not the case, of course, in Scotland, where we have prioritised investment in our school estate, which have shown in the latest statistics that over 91% of our buildings are now in good or satisfactory condition. And of course, East Dunbartonshire Council have benefited additionally from £10.2 million towards schools in their area through the previous Schools for the Future programme, and they are benefiting through the LEAP programme. But I'm happy to continue to work with the member on this issue, and I recognise the strength of feeling locally too, and officials will continue to engage with the local authority.
Pam Gossel.
Thank you, Presiding Officer. Worried parents have written to me, including the President of the Parent Council, expressing distress over the state of Milngavie Primary School. I visited the school premise last month and it was clear that more substantial work needs to be done. I have also received correspondence from parents at Westerton Primary School in Bearstone who said that the school's building is in dire need of repair. Therefore, I would like to ask the Scottish Government what action it is taking to ensure that children's safety in schools is a #1 priority.
Secretary.
Well, I think, again, worthwhile reminding the member that the school estate does not belong to Scottish Government. It is an estate that is owned by local authorities. So the responsibility for the school estate rests with the local authority. I very much hear the strength of feeling from the member that has also been reflected today by Ross Greer. I hope she hears my continued commitment to engage with the local authority on this. And, of course, the Government has provided significant additional investment to improve the quality of our school estate, from approximately 61% being in good or satisfactory condition back in 2007 to over 91% today. That has only happened as a direct result of investment from this Government. I hope the member recognises that, and I commit again to work directly with the local authority on helping to drive the improvements in the primary school named.
Question number 5, Miles Briggs.
Thank you, Presiding Officer. To ask the Scottish Government what assessment it has made of the number of people who are not aware of a Do Not Resuscitate order being placed on their medical notes, including in relation to next of kin and power of attorney holders.
Cabinet Secretary Neil Gray.
Thank you, Presiding Officer. The Scottish Government does not centrally collect information or data relating to the number or use of Do Not Attempt cardiovascular resuscitation DNA CPR forms. As with all other clinical treatments, decisions about CPR should be based on the individual clinical circumstances and wishes of the patient and recorded appropriately. This is done in hard copy on a DNA CPR form, the existence of which is then recorded on an individual's key information summary. Such information is only shared for the purposes of direct care and is therefore not centrally collected.
Miles Briggs.
I thank the Cabinet Secretary for that answer and acknowledge the fact the Scottish Government are not collecting this information. There have been serious concerns raised, especially during the pandemic, with regards to the use of DNR, also known as Do Not Attempt resuscitation orders, and wondered where the Scottish Government actually are looking at changing that process, and what investigation have ministers actually undertook to assess how many patients may still not be aware that they have a DNR order placed on their medical notes, and will the Cabinet Secretary look to review this and the collection of this data by the Scottish Government?
Cabinet Secretary.
I thank Miles Briggs for raising an issue which is obviously incredibly sensitive, and I recognise the strength of feeling that there will be for patients and for those that Miles Briggs seeks to represent today. In 2016, the DNA CPR policy was reviewed to reflect feedback and changes in the UK-wide National Good Practice guidance from the British Medical Association, the Royal College of Nursing and the Resuscitation Council UK. Legal changes resulting from case law and specialist legal advice was provided as part of the formation of the policy, and the Scottish Government continually reviews best practice and advice relating to resuscitation. We are undertaking work to improve our electronic recording systems to allow us to provide more clarity on care planning at a local and national level, and recognising the sensitivity here, if there is further discussion that would be helpful for Miles Briggs in a more private space, I'd be happy to facilitate that.
Question number 6, Elena Whittam.
To ask the Scottish Government whether it will provide an update on what action it is taking to improve access to audiology services.
Minister Jenny Minto.
Thank you. Audiology is being considered as a clinical priority area, and improvement work is now being progressed through the National Planning and Delivery Board arrangements led by the Chief Operating Officer NHS Scotland. I wrote to the Health and Social Care and Sport Committee on the 23rd of September to outline this work, and committed to writing to the committee again in January 2025 with a further update of progress.
Elena Whittam.
I thank the Minister for her answer. The Minister will know that it is cost-effective to provide hearing loss services for adults in the community rather than in hospitals, and that primary care and high street audiologists are expert clinicians who can improve access to care in communities throughout Scotland, timely addressing hearing loss at the right time to reduce associated loneliness and isolation. Does the Minister agree with me that we could benefit from approaching hearing loss in Scotland the same way we approach eye tests in the community? As per Specsavers' recent report, its time to talk about hearing to improve patient experience and relieve pressures on valuable NHS resources?
Minister.
I thank Lena Whittam for her question and recognise, as I have visited a glaucoma service on the High Street, the benefit that that has given to patients, as Lena Whittam outlined. We remain committed to our vision for an integrated community-based hearing service in Scotland. In considering the future direction for the sector, it's right we move forward in step with the work of the Independent Review on Audiology. This, together with the wider financial and strategic context in which we are currently operating, has necessitated the rephasing of our commitment on community hearing. However, we are continuing to work with NHS, third sector and private providers to identify appropriate models for community care for any future service reform, ensuring those with lived experience inform this work.
Brief supplementary, Carol Mockin.
Thank you, Presiding Officer. People in the south of Scotland are continuing to report to me they are being left to navigate a very bureaucratic maze just to get proper diagnosis. That's a year after NHS audiology services were highlighted as having a multiple systemic problem by an independent review. So can the Minister commit to some urgency around dealing with this bureaucratic maze?
Minister.
I thank Carol Mockin for her question and recognise the urgency that is required, which is why I'm very pleased that the Chief Operating Officer of NHS Scotland is leading this work with the Task and Finish group, and I get very regular updates on progress, as do members of the group and third sector organisations.
Question number 7, James Dornan.
To ask the Scottish Government whether it will provide an update on the annual performance of Social Security Scotland in 2023-24.
Cabinet Secretary.
Social Security Scotland published their annual reports and accounts, and the Chartered Measurement Framework results this week. Findings show 90% of respondents say their overall experience was very good or good. And in the last financial year, we paid over £1.9 billion to people across Scotland. During that time, we have launched carer support payment nationally and a pilot of pension age disability payment. We now deliver 15 benefits, 7 of which are only available in Scotland.
James Dornan.
I thank the Cabinet Secretary for that answer. And of the £1.9 billion issued in devolved social security payments across Scotland, over £277 million was invested in Glasgow, including to my Glasgow Cathcart constituents. Can the Cabinet Secretary outline for Glasgow and for Scotland as a whole how much of Social Security Scotland's investment went to devolved benefits unique to Scotland, not available anywhere else in the UK, such as the transformative Scottish Child Payment?
Cabinet Secretary.
In 2023-24, Social Security Scotland invested £500 million in benefits unique to Scotland. Of this, £80 million was invested in the Glasgow City area. Our investment will support 1.4 million people this year, around 1 in 4 people in Scotland. And Social Security Scotland's benefits are helping keeping children out of poverty, assisting people to deal with the rising living costs, as well as supporting disabled people and carers who devote their time to care for others.
Number 8, Mark Ruskell.
Thank you. To ask the Scottish Government what its response is to His Majesty's Inspectorate of Constabulary in Scotland's latest report on road policing.
Cabinet Secretary Angela Constance.
Presiding Officer, my thoughts are with all of those who have been affected by road death, and I am grateful to HMICS for producing the report, and while it is for the Chief Constable to determine how to allocate her resources, I welcome confirmation that the service is already taking action to address the issues raised, including the identification and implementation of a sustainable model for road policing.
Mark Ruskell.
Can I thank the Cabinet Secretary for that answer? It's quite clear that speed kills and that communities across Scotland are fed up with dangerous speeding which goes undetected, unenforced and unpunished by the police and the courts. This is a rural problem, but it's also an urban problem. So does the Cabinet Secretary believe that it's time to devolve responsibility for speed enforcement to councils, allowing communities to control dangerous speeding and creating a much-needed source of revenue to invest in safer streets?
Cabinet Secretary.
Presiding Officer, in terms of investment, I would like to assure the member that road safety indeed is a priority for the Scottish Government and indeed Police Scotland, which is why we are investing a record £36 million this year to deliver initiatives aimed at improving driver behaviour and ultimately to help reduce the number of casualties on our road. The member may also be aware of the new digital evidence sharing capability system, which will enable members of the public to upload footage from mobile devices or from computers, making it easier to share evidence, allowing swifter access to justice and helping cases to be resolved more quickly.